This video tells the stories of 7 women and the choices they made for surgery. Not all the choices presented in this video are appropriate or available for every person with breast cancer. Choices given to every woman depend on the location of the tumor, its nature in terms of aggressiveness, and the absence or presence of cancer spread beyond the primary tumor.
The video that you are about to see today was made to help you make the decisions about your surgical treatment that you are being asked to make by your doctors. You're about to meet 7 women who were diagnosed with breast cancer and have undergone different types of treatment. As a group, their treatment includes the choices for surgery that your doctor or cancer specialist may have recommended to you. The first 2 women you will meet are Milagros and Joan. Milagros and Joan decided to have breast conservation. They had a lumpectomy, which is removal of the cancer from the breast with a rim of surrounding normal breast tissue. The doctor also removed the lymph nodes under their arm.
When I entered the office, the doctor already, he had an idea of what he wanted to do. He didn't ask me what I wanted. He told me that I needed a mastectomy because of the kind of cancer that I have. And when I went for the second opinion, the doctor, he explained, it was more clear. He showed me pictures, he gave me books to look at and the different choices that a woman have. And he told me that I could go with only a lumpectomy, I didn't need the mastectomy.
My surgeon did talk to me about my options. You know, he recommended, well, I don't know if I would go so far as to say he recommended, but his opinion was that a lumpectomy with radiation and possibly chemotherapy, depending on the results of the surgery, would be the way to go, unless, of course, they got in and found something other than what they thought they were going to find. I think as far as my decision-making process, I was very comfortable with him right from the beginning. I trusted his judgment, and probably he was telling me what I wanted to hear anyway, because the choice of a lumpectomy rather than a mastectomy was an attractive one to me, so I didn't see any reason to argue with him over it.
The next woman you will meet is Valerie. Valerie decided to have a modified radical mastectomy. In this procedure, the entire breast, nipple, and the lymph nodes underneath the arm are removed. She decided not to have any type of breast reconstruction.
The surgeon gave me the choices of what my options were to go from there. I could either have a lumpectomy and have radiation and chemo, or I could have a modified radical. The surgeon wanted to know if I would like reconstruction, and when my husband and I talked it over, we decided that we didn't want to go ahead and have reconstruction. It would just be another assault on my body, and your body can only take so many of them before it decides it's gonna, you know, just give you a problem.
The next 2 women that you will meet either decided or needed to have their entire breast removed. Mari had a total mastectomy. Paulette had a modified radical mastectomy. Unlike Valerie, Mari and Paulette decided to have immediate reconstruction of the breast.
My surgical options were up to me if I wanted to do the partial removal of my breast, or if I wanted to have it totally removed with the reconstruction, and gave me some time to think about it. Looking at the mammogram x-rays, appeared to have several spots in different areas, and that's why I chose to go with the total mastectomy. My first surgery was to have the expander put in, and then I would go every week and he would add some saline to it.
I remember very clearly my surgeon sharing the news with me that the biopsy was positive, and she informed me that Because cancer had indeed been found in more than one place in my breast, I did not have any options. That breast conservation was not an option. I would have to have my entire breast removed. And in the same breath, which was joy to my ears, even though I didn't understand what it meant, she told me that I could have immediate reconstruction. Now, I had certainly never heard the terms immediate reconstruction related to breast cancer before, because I'd never had breast cancer. But it sounded like I could get up off the operating table with a breast in place, and so that sounded wonderful to me, and so I said I would take it. So I was not given any surgical options. I had to have a mastectomy. He offered me the choice of having tram flap, an autologous tissue transplant from my stomach, or he also does saline implants or something like that. I just knew I already had invasive tissue, foreign matter, stuff that didn't belong in my breast, and I was not about to put anything else in my breast that was foreign, that did not belong already in my body. So truly, having an implant was not an option for me from the very, very beginning. I just knew when I heard about that surgery that that was what I wanted, and I certainly had enough stomach to give at that point as well, and so it all worked out very well.
The next woman that we're going to meet is Veronica. Veronica decided to have bilateral mastectomy, which is removal of both breasts. She also had a sentinel node biopsy to determine whether she had cancer within her lymph nodes and tram reconstruction.
I went for a mammogram, and they also gave me an ultrasound. And they did find a suspicious area, so they decided to go ahead that evening and give me a needle biopsy. Had the needle biopsy performed, waited about a week, and then I was contacted, and they said that you have abnormal cells and you need to see a breast surgeon. Went to see a surgeon, and then I had a core biopsy performed. I also waited another week for my results, and that's when my physician called me on January 3rd and said that I had breast cancer. I went ahead and scheduled surgery, and at that time they did the sentinel node prior to my mastectomy. They injected a dye into the area where my cancer was located. I actually had 2 tumors in my left breast, and they injected the dye. When he went to do the surgery, one of my nodes, my main nodes, lit up. So that meant that it had cancer in it. So at that time, he decided to go ahead and remove 20. I had the 20 removed, and after surgery, about a week later, he called me back and said I had the one that they found during surgery, and then additional 3.
The last woman that we will meet is Rebecca. Some women may decide to have their breasts removed because they have a high risk of getting breast cancer. Rebecca decided to have a prophylactic mastectomy, which is removal of the breast before developing breast cancer. Rebecca chose to have saline implants after her mastectomy and subsequently developed complications that required their removal.
I come from a family with 10 members who've been diagnosed with breast cancer. All of my medical providers, all the physicians, and all of my friends who were physicians strenuously urged me not to have prophylactic mastectomy. They thought it was premature, it was a little hysterical, and that I should wait for a symptom to appear. The problem that I had was that neither my mother nor my older sister had any symptoms that appeared early on. My mother's lesion was only discovered when it was palpable, and by that time it was golf ball size, even though she had regular mammograms. And my older sister's lesion only appeared when she was scheduled for a hip replacement, which of course was not arthritis, it was metastatic cancer, breast cancer that had moved to the bone. So I felt I couldn't wait because these lesions weren't showing up with the, the diagnostic devices and procedures that were available at that time. It was then and is extremely rare for someone to elect prophylactic mastectomy. I did have an OBGYN at the time who was adamant that I should have the surgery as quickly as possible. One morning, in the middle of all of this trauma, trying to decide whether to have the prophylactic mastectomy, I awakened from a dream that was so clear that I woke my husband up and I said, my mother came to me in a dream. And my mother had died of breast cancer. And he said, what did she say? And I said, well, she was at the end of a long tunnel. I was in the tunnel, and I was in very dark gray. And I was looking through a jagged opening out the tunnel and could see her profile. And she was saying, in a voice I hadn't heard in like 15 years since she had died, what the heck is she waiting for? Now, is it wishful thinking? Is it, who knows what it is? But I acted on it and pursued the surgery. I mean, it removed the last bit of doubt for me.